Good morning.
So we got a break today for dialysis. Give you a little chance to, just give you a chance to just catch up and go from there. I was reading through some of the case management notes. So I thought we had talked the other day about y'all going to Green Acres with Fresenius.
We had some issues with that. Edie called me yesterday.
Okay.
And Edie said, Mr. Green, we can get your wife started on January 3rd.
Okay.
And so
Yeah.
I said, fine, that'd be great. I said, depending on Dr. Wangs and when she's be released. I said, I really don't know when we're going to be released, but if that's what we need to do, as a prerequisite, yes. She said, we have a Monday, Wednesday, and Friday.
Okay.
11 and say, what did you prefer? I said, she said the time they had. It was in the morning. It was perfect.
Okay.
She said, okay, well, depending on, you okay, honey? Okay. Depending on the authorization of the financials, we got you set up, be ready to go January 3rd.
Okay.
I come back, we're celebrating.
Okay.
Hey, we got it going. I mean, we started planning different things.
Sure.
According to what was told.
Okay.
Well, she calls me back 30 minutes later
Uh-huh.
and asked me if my wife was working. I said, well, normally people get insurance through their work.
Okay.
I said, but technically, no, she's not working because once she gets out of the hospital, she's going to be, I would even good 2 months before we even start talking about something else.
Okay.
And she said, well, unfortunately, she falls under our working class schedule, and we can only put her on Tuesdays, Thursdays, and Saturdays at 5:45. She asked me before. I said, no, man, that's not going to work for us. We travel. We can't do that. Just so many other things. Those days don't work for us.
Okay.
Well, like I said, that's the way we operate here, and you can take it or leave it.
Okay, so it was the schedule that didn't quite fit. She told you one thing and then...
And took it back.
Okay.
And then we called our case. That's okay right now, huh? While they're in here. Thank you.
Okay.
Thank you.
And so then we called our case manager, and the insensitivity associated with that was horrendous and horrific.
Okay.
She basically came in here with an attitude. But yeah, that's either there.
Okay.
Yeah, so I went ahead and said, we don't even want to deal with those type of people. So I called DeVita.
Okay.
So I'm sorry we had to go through that, doctor, but I mean, I'm an adult.
Well, I mean, I'm sorry that all happened. It sounds terrible, but I think with DeVita, we don't typically go over to DeVita.
Okay, well, we'll have our case, whatever we need to do. Now, if you can get us back over there in our regular schedule, we can do it, but we're not going to take that other one. But that's not. We don't operate.
So I haven't spoken with.
Okay. Okay.
So I'll talk with the case
That'd be
manager
great.
and see. We don't really control the schedule. It's just what they.
We understand. Totally. Totally
Totally
understand that. We're totally aware and clear.
I can understand a working schedule, but if you're not working.
Right.
Well, we don't have the capacity to deal with that emotionally, doctor, and that's what I'm saying.
Well,
It kind of came in.
It was more than that. It wasn't, okay, it was fine that she's canceled it. I mean, not fine, but we were like, what are we going to do? So, we started thinking about it, and then Miss Linda came up here, and it just went way left.
Okay.
And at that point, it was like, that's how it wasn't just that they canceled it.
Sure.
Then, we made the appointment, and then
We thought the caseworker was our liaison to get this fixed.
She said she was the caseworker, but we had never met her, and that was the first time we had seen her, and she, came up here to basically ask, like, why did you not take the appointment or whatever. I don't know what was communicated to her, But
Okay.
she didn't even know that we were getting an appointment. I wanted to communicate with her. She was basically, and not that she was coming to the recommenders, but it was like, you didn't take the appointment. And I was like, no, she made the appointment and we took it back. And the reason, which is why I was so frustrated, was because I was employed, and so because I was employed, I guess normally people who work during the day, they put them in this evening slots.
Yeah.
So that's
they do.
why he said, like, okay, well, first of all, she works remote.
Right.
That's so her going to the office is not an issue.
Right.
And second of all, she's not going right back to work right
Sure.
this
Taking
second.
some time.
So
take a
that
break
shouldn't
okay.
that shouldn't influence whether or not she gets the slot.
Okay.
And her response was just like, it was just such a blow off, And then for Miss Linda to come up to her and
Okay.
it just went bad. So it's
And then
more
she
than
argued with me, in front of the patient. That's a patient rights violation. She just went off on me in front of her. Several people have. I have no say, so my opinion to them is not valid. They'll come in, doctor. She's asleep. When she had the stent put in her neck, 2 or 3 people came in. She was out of it on pain medication. People come in here and will not even acknowledge me. And she's asleep. I'm trying to talk to her asleep. That's poor and pathetic. It's poor and pathetic professionalism. It's been a nightmare here, doctor, and it's affecting her. She can't hear. I don't think she's feeling well because everybody's coming in, getting into it with me in front of her.
I'm just trying to stay focused on, what I need to do. I don't really know what that is, what's the goal to get out. But I did know that I had to have
Yeah, we want to work with you, Dr. Long.
So it's the same 2 things as we talked about the other day. I think I talked separately. But
Yeah.
The one is going to be getting an outpatient dialysis here somewhere. And
Yeah.
we'll talk with the case managers and try to figure out competency. And then 2 is, Dr. Smith and I, we were going back and forth. Because the other day, you had mentioned to me you weren't quite feeling yourself and still a little weak, so getting the therapist to come and work with you and assess your strength and see how well you can walk and move around. Because those are probably the 2 big things that will determine when we want the dialysis about that. And if not, it's okay. We can still get set up with rehab and get the strength back. But those are probably the 2 big things that are keeping you here. So.
I don't know if so much strength is my issue. It's like
And then that's where they can come and help out too. It's more than it's all motor.
It makes it hard to walk because I don't know. I'm tentative, because I can't tell whether or not.
Well, and that they will do that too. They'll assess your balance as well. So yeah.
Well, and I did inquire with Nikki, the nighttime supervisor, about PT, and her response was, well, when they put those orders in, you never know. I was just trying to get an ETA about when we might start, because if and I was so you have any idea of that, or? How does that work?
Usually the order gets put in and then they come by, they kind of walk around the same time we do.
Yeah, we didn't, okay, that was yesterday, we haven't seen anybody. So that's why I mentioned to her, have we, that's why I was asking, we don't know.
Yeah, like I said, I'm fine, I realize now I can walk.
Okay.
It's just, wobbly.
Yeah.
Real wobbly.
Well, and if it's something as simple as, hey, maybe perhaps you just need a little, like a walker or something to help you get around, and they can help make those assessments and with the balance and strength and everything together.
But
so.
that,
Okay.
I think I'm assuming that as long as I didn't take the pain medication, because that worked, that worked like a charm, not taking the pain medicine. So
Okay.
I was able to feel,
Well, and that can always mess with your balance and everything else. Too.
Yeah, so, because at first it was just, I'm hurting and I'm thinking, well, whatever. But now that I don't have the pain medicine, and I can feel where the pain is, it might be a 1 or 2, now back there, so it's definitely not pain medication worthy.
Okay.
But that's how I found out it was my balance and not,
Okay.
you know what I mean? So that worked fine. And like I said, not having to take the pain medication, I'm realizing that, you know, that infection, you know, has successfully been treated. So,
And I think we've talked about it too, you know, unfortunately with PKD, those cysts do independent of infection. They can get bigger.
yeah, I know.
Starts to push
Yeah,
and
it's been
pull
like-
and
Yeah.
so
Yeah.
once you're out of the hospital and everything, I don't think it's a bad idea. We were chatting about it, about getting you with a urologist to get plugged in with them.
Mhm.
So, okay.
Yeah.
Okay. Well, do you mind if we take a quick listen too? Is that all right?
Mhm.
Yeah, yeah.
Are you okay over there? I don't want to put you in the corner over there.
No, I'm good, thank you.
Yeah.
Are you right or left? Right.
Is the dizziness better, like when you're going from laying to sitting up? How you said it was kind of a little. Okay.
Now, who do you have here, Dr.
Like,
Moore?
that was fine.
Oh, this is Misty. She's our nurse practitioner.
that
Here?
works with the kidney doctor.
Well, she's the same crew.
I work with their practice.
No, but we haven't met her before.
I met her yesterday.
Oh, okay. Well, I haven't met you. I'm her husband.
Well,
now.
so same as I mentioned yesterday, right? Sometimes when we see you, you're over on dialysis and you're not in the room. So.
Well, yeah, but I'm just saying she's here today, and I just didn't know who she was, so
Yeah.
there was
Oh, you'll see her
there was
quite
no
a bit.
introduction. That's
Yeah.
all.
Okay.
I forgot.
The dizziness.
Oh, yeah. Like, I was kind of okay, and then it came and drew blood from my port, from the
Oh, the midline.
midline, and so now I got like, I started getting like this weird, like, not dizzy, I don't know if it's dizzy, I don't know if that's the word, but just like this weird whatever, so now I'm a little bit, you know, like lightheaded, but I don't know, I'm just assuming.
Yeah.
And that'll help with the protein built up. too.
Right. So I'm just saying, like, I feel like once I get to maybe it's just like, you know, me feeling like I took a walk, you know, and that's, so, yeah, I mean, you know, I'm working on it, I'm trying to, you know, do things as I said, and just be patient with, you know, the process of, you know, I mean, cause you guys can't, I mean, your job is to, you know, help me, heal, but you can't lay your hands on me and heal, and then I'm healed like 10 minutes, you know what I mean?
It would be nice if
So
it was
there's a
nice to
pro-
see,
We're
there's
just
a
not that good
process.
yet. We're just not that good yet. Yeah.
So there's a process, so I'm just, you know, I'm just trying to work through go through the process with you and be patient. I just feel like I have bigger fish to fry right now. I gotta figure out how to take this feels like a new life for me. And I gotta figure out how to be myself and not feel like this whole thing is just like taking away my quality of life and that my life is over, you know what I mean? So that's what I'm trying to, you know, think about now, just like stay focused. I don't want this to be, you know, something that, you know, puts me under. 'Cause it could, I've seen it.
No.
You know, I'm just saying, I know it's possible.
No.
Not necessarily with me. I'm just saying,
Right.
I've seen it with my family,
Okay.
and I've seen it with, you know, some friends of mine, you know, who just, you know, they get on dialysis and, you know, it's over. So I am intent. I'm making sure that that's not me. So that's what my focus, you know, is. I'm trying to put my focus on just getting better and getting to that point where, you know, all right, I got to get up on Tuesdays, go to dialysis at the center, and, you know, go on with, you know, that's just part of my routine, part of my life, and be okay with that. You know, so that's really where I am. Like I said, I feel better.
So what schedule did you say, you guys say was the preferred?
Well, we wanted Monday, Wednesday, and Friday.
In the morning.
In the morning.
That's what, it was like 11:45.
Right.
But that was
Probably
good.
the second.
But,
Okay.
I ended up having to take Tuesday, Thursday, and Saturday with Davita at the same time slot. But
At the morning, that 11 o'clock or so. Okay.
yeah, but it was on Tuesday, Thursday, and Saturday, which,
Gotcha.
you know.
Okay.
At least in the morning.
Yeah,
So,
Lisa
so
said-
Get out of our
is that DaVita spot, is that confirmed, like it's done, we're settled on that?
I don't,
Well,
not
this is a
necessarily,
Cause it,
I just-
okay.
cause I don't know what the
Well,
process is.
I'm sorry.
Yeah, I don't really
We
know.
don't know what the process
Yeah,
is.
we don't really
but
know what
it's
the
been,
process
it's in
is.
the process of being confirmed. But because of, you know, we were put in that, but we love your work and we would love to stay with you.
I really
then-
wanted to do it, you know.
Yeah.
with
Yeah.
the
So
same
let me do this then. Let's,
Renala.
thing. You know, we're,
yeah, this little,
Renala.
you know,
It's like
That's
it's like renal S, but Renala.
yeah, that's the name of our practice.
Oh, okay. Yeah, I mean, I wanted to, but, you know,
Well, in that
I
case,
just,
then, would you be alright if we stepped out and then we talked with the case manager and say, hey, look, we talked it out, right? Cooler heads, and if we could try to see about checking back with Green Acres about what their actual spots are Monday, Wednesday, Friday, if they do have availability. It sounds like they have the availability, maybe there was some mix up with the work schedule thing, that's my guess. We can talk with them, would you mind if we did that? Is that okay?
That'd be great.
that's
Okay.
fine. Yeah, thank you.
And then that way.
That way we at least know what options are there.
Yeah, yeah. Yeah, because I mean, yeah. So, yeah, we'll step out and we'll do that, okay? And then we'll let Dr. Smith finish up with it.
Thank you so much, Dr. Long.
I'll stay on.
Thank, is it Christy?
Misty.
Misty,
Misty,
yeah.
I'm sorry.
Yeah, no problem.
Thank you.
You take care, okay?
You too.
Yes, sir.
The, Vincent,
Really?
the one that was in the, walked in with the
Really?
transfer, really in the. That's not.
She didn't.
The next day.
She didn't.
He's 55 today.
Okay.
I don't know what time, but the order's been in there. It's in there, and so I don't know what to tell you. It's definitely in there since about this time yesterday. So,
All right. How you doing today, Dr.
I'm
Smith?
all right.
You sure are a snazzy dresser.
Well, standard stuff. Nothing fancy.
Yes, it is. I know you. Where'd you go to college, doctor? Or where'd you go to medical school?
University of New Mexico.
Oh, Lobos.
Would you like to take one?
Just wait till he finishes, and then he can do it. You need to get under there. Where'd you go to your undergrad?
Mexico State.
Oh, wow. You know, I was an All-American basketball player, and I was recruited to NMMI in Roswell.
Right?
Yes, sir. I didn't end up going there, but I sure regret it, because I heard good things about that school.
Yeah. Institute.
New Mexico Military Institute.
Yeah.
Are you from New Mexico?
Yeah.
Oh,
So,
cool.
Well, let's get your chair time set up, and when that's arranged, then you can get out of here. In the meantime, we'll just have you on the schedule
Okay.
routine, 3 times a week. Orders in there for physical therapy. I don't know what the delay is getting you seen.
What's her creatinine looking like today?
It's like 5.6.
Oh, okay. Is that good, huh? Is it good? or-
It's not good.
Well, it's not normal, but
Yeah.
that's
But
What,
it's
what's
better.
good?
It's better.
one.
Oh my gosh.
Yeah.
Huh.
So
Blood pressure look good?
it's kind of on the lower side
Lower
of normal, and
What-
maybe part of the issue with your lightheadedness and that is
Low blood
your
pressure.
little maybe volume depleted. You certainly don't have any excess fluid that we can appreciate.
Right.
So, and I know they're not pulling a lot of fluid with dialysis, so it's more of a cleaning process now than pulling
Oh.
off fluid.
Oh. So when you actually start going, then that's when the real work begins.
Well, no, it's just that, when you do dialysis, you can do either cleaning or you can pull volume.
Oh.
And
The
hers,
first 2 times I think they did. Volume.
yeah,
The
they
second
haven't.
time they did. The third time, yesterday, they did clean.
So they just did the cleaning part of dialysis and not much volume reduction. So the volume status appears to be pretty good. But let's get PT by and see. But if you're just weak, that can make your balance off too.
Uh-huh. Yeah, you were weak, honey. You were weak.
So we'll work on the strengthening part with PT, and they should be by today. And then the bigger issue is getting your chair time arranged, and sometimes like we talked about earlier, sometimes it takes up to a week to get that arranged.
Uh-huh.
Yes.
We'll see.
Okay.
It won't take that long.
You gonna be here on the new year?
Yep, we'll be around.
All right. Thank you. Have a good day, Dr. Smith.
You too.
Thank you.
Okay, you're going
Thank you for your patience, Miss Angelique. I really appreciate it. Thank you for your patience, Sean.